out there. We're going to be talking about periodontal splinting and its role in periodontal disease management. Periodontal disease is an inflammatory disease, and yet trauma from occlusion has a significant role in the modification of this disease. And we shall be talking about how periodontal splinting might be a factor in the management of periodontal disease. The 2018 classification of periodontal disease classified periodontal disease into 4 stages. Stage 1 with clinical attachment loss of 1 to 2 mm, stage 2 with clinical attachment loss of 3 to 4 mm, and stage 3 and stage 4 with clinical attachment loss of greater than 5 mm. And yet there is a significant differentiator between stage 3 and stage 4. Stage 4 is compromised with greater amount of tooth loss in addition to other factors that complicate periodontal disease and its management, like significantly secondary occlusal trauma with tooth mobility greater than degree 2. So what is secondary occlusal trauma, and how does tooth mobility and secondary occlusal trauma complicate disease presentation and its management? We shall be looking at this through the rest of this presentation. Primary occlusal trauma is where there has been no significant destruction of the periodontium, and yet the periodontium receives greater than normal occlusal forces that cause the periodontal tissues to receive injury that require it to repair and go through a process of remodeling. Now, this primary occlusal trauma can be frequently corrected by reducing and correcting the increase in the amount of occlusal forces that are being brought to bear onto the periodontium. On the other hand, there is that which is classified as secondary occlusal trauma. In secondary occlusal trauma, the periodontal apparatus is compromised by periodontal disease, so that normal occlusal forces turn out to become traumatogenic to this compromised periodontium. And this is what complicates the clinical presentation and the management of periodontal disease, wherein the periodontium is compromised so that even normal forces turn out to be traumatogenic to the compromised periodontium. So what is trauma from occlusion? Trauma from occlusion is a term that is used to describe pathologic alterations and adaptive changes which develop in the periodontium as a result of undue forces brought about by the masticatory muscles as the teeth occlude. Now, trauma from occlusion refers to the tissue injury rather than the occlusal force. So the injury we are talking about is the injury that occurs to the periodontium. So primary and secondary occlusal trauma are injury that occurs to the periodontium, where either an increase in the amount of occlusal forces or the occlusal forces that are not increased but are brought to bear on an abnormal periodontium, wherein the periodontium is compromised by periodontal disease that causes tissue injury. Both of these cause significant alterations to the periodontium, and we shall be talking about how these alterations could compromise disease presentation. A significant factor in the clinical presentation of occlusal trauma is tooth mobility. Now, tooth mobility is that significant clinical presentation which indicates clinically that the patient would perhaps be having occlusal trauma that is being brought to bear onto the periodontium. Now, what causes tooth mobility? There are two significant factors that are important. One, where the tissues are compromised so that the height of the periodontium is reduced. Now, that would indicate that the reduction in size of the periodontium would now cause tissue forces that were previously normal to become abnormal to this compromised periodontium. Now, another factor that can cause tooth mobility is the width of the periodontal ligament. Now, when there is increased amount of occlusal forces, the width of the periodontal ligament widens because of the tissue injury and the accompanying remodeling process. So these are two significant alterations to the periodontium that occurs primarily due to occlusal trauma. Now, with biofilm-induced periodontal disease, there is another factor that is thrown into the works that can compromise the disease presentation. This is biofilm-induced inflammatory changes, or just inflammatory changes per se. Now, inflammatory changes that might occur to the periodontium could be due to periodontal disease, or they could be due to endodontic disease, or even just due to hormonal changes that cause greater amount of inflammation to the periodontium. Now, all of these could cause significant alteration to the inflammatory status of the periodontium, and as the inflammatory status of the periodontium changes, the tissues become more compromised in their clinical presentation, and we need to look at how this change occurs as we try to understand how occlusal trauma might compromise the clinical presentation of periodontal disease.